We are on the Health Watch here. At the moment, there are now over 6.5 million people living with Alzheimer's disease in the United States, 80,000 of them right here in Connecticut. Now, a new report released by the Alzheimer's Association took a good look at the burden of the people caring for the people who are living with this disease. So here to talk more about that, Kristen Cusato with the Connecticut chapter of the Alzheimer's Association. Good to see you again.
Thank you for having me.
You do such a good job of making sure we are regularly talking about Alzheimer's disease, and we're usually talking about the people living with the disease. It's good that we're talking more about the caregivers here.
I think so. You know, there are 11 million of them here in the United States, and who are they?
Yeah.
They are 2/3 women,
right,
1/3 daughters, and 1/4 sandwich generation, which is taking care of your parents as you raise your children. And as you know, many people say it's the hardest job they've ever had is caring for somebody with dementia.
Do we know why it's 2/3 women? I mean, I know women are generally expected to live longer. That probably plays a role in it.
Live longer. There's some hormone tech we're checking out to see what's happening with women. Do women's brains, process this different from men's brains, that kind of thing.
Right.
So we're really looking at that as well.
Yeah. Okay. Now, what else is the report saying about the burden they're sharing?
Yeah, we know it's really incredibly taxing financially, physically, emotionally. But what's different about this report is that caregivers are self-reporting. They are saying, hey, this is really hard. It's really hard to watch my loved one go away.
Yeah.
Caregivers, they don't sleep, they don't eat right, they don't go to the doctor's office. So what we're finding is 64% of caregivers right here in Connecticut say they have at least one chronic health condition.
2/3 of the caregivers have a chronic health condition.
And then 30% say, yes, I am depressed, which is not a surprise. This is a very challenging disease. And then 10% are saying, I am in poor health. Straight up, I'm in poor health. So what we want people to know is they don't have to go through this alone. Right? Call us, our 800 number, 800-272-3900. You can have a care consultation where we can guide you. You can find out about support groups, all the really important things. Don't do it alone.
Yeah, it seems like you need to short circuit what could become a very vicious cycle. If the caregiver's not taking care of themselves, that in turn is going to affect the care that they're giving.
It's the take your oxygen first
thing
on the airplane.
Just like on an airplane.
Make sure you care for yourself.
Right, and that's a great analogy because it's an analogy that seems counterintuitive. No, I want to take care of somebody else.
Of course.
No, you've got to take care of yourself first. All right, what about the dementia workforce issue?
Well, we know that more people are not choosing to go into this as a specialty for doctors, so we know that a lot of people need to do that. We hope that more people go into this field. But what we also know is here in Connecticut, we'd need to increase the dementia workforce by 20% to keep up with our aging population. Like you said, we're living longer. This is an older state, Connecticut.
Yes.
What we're also finding out, Tim, this is crazy numbers right now. More than 60% of the in-home workers that go to the home to take care of people turn over every year.
Okay.
And in the facilities, 99% of nursing assistants turnover. That's bad. That's bad news.
So all of them. Let's
pretty
just
much
say
all of them. It's a complete turnover. So what needs to happen? They need to be paid more. They need to have dementia education and skills so that the stress level doesn't get really, really high of the workers. And then on the other end, it's not good for the person who's in the bed or the person who lives there, because seeing the same person every day is important. Keeping environment, familiarity is important. So we really need to work on that for everybody. It's
special care. It requires specialty training. It's a shame you're saying there's not enough people who want to go into this because, I mean, I don't mean to be glib about this, but it's a growth industry in the worst possible way. The numbers of people expected to be living with Alzheimer's is going to explode in the next 20, 25 years. So hopefully some people will take up that mantle and try and do what they can. And thank you for shining a light on the problems that the caregivers are dealing with, Kristen. It's
Absolutely. Anytime, people just go to our website or give us a call and we're there for you.
You got it. Good to see you again.
Thank you, Tim.